want to welcome you this afternoon on behalf of Baker Biotechnologies, and hopefully we have some information that ultimately can help and change the quality of lives of people with various diseases and disorders, such as ALS, ataxia, autism, Batten's disease, diabetes, epilepsy, Huntington's disease, multiple sclerosis, muscular dystrophy, Parkinson's disease, spinal injuries, and optic disorders. Most of the people speaking today have one or more of these disorders, and these same people have all had stem cell treatments for their specific disorders. Because the patient's success rate of stem cell treatments is 90%, we want to share this with you. These patients have all shown significant progress and now have a better quality of life. This treatment is not available in the United States yet, but these people still need help from their organizations post-op with medical tests, evaluations, therapies, braces, canes, glasses, etc. We know we can't fund a treatment in other countries, but you can help with their needs in this country.
Keep in mind, when Edward Jenner invented the smallpox vaccination using cowpox, he was basically ridden out of town, saying you can't do that, it doesn't work, and Louis Pasteur and all great scientific breakthroughs have been met. We have an extra issue in this country where stem cells have become a political wedge issue. That's not really helping the situation either. The new president will sign an executive order. Stem cell research is not against the law in the United States. The federal funding of it is against the law. That is to say, the federal budget cannot be used to support embryonic stem cell research. These are umbilical. That should remove some of the controversy. And once that executive order is signed, if there's any money left in the Treasury, it can be applied towards this. It can be applied towards this once the executive order is signed. Now, I'm quite familiar with stem cells. They've been used for hematologic cancers for a long time. You basically destroy the bone marrow, somebody with leukemia, and use hematologic stem cells. And I've had other patients go to Europe, to Asia, for stem cell treatments for ALS, Lou Gehrig's disease, if you will, and also go for spinal cord injuries, Parkinson's. We know that lion tamer, Siegfried and Roy, went to Germany for stem cells and came back more functional. It's not a magic bullet. He didn't come back walking on tiptoes, but he came back with better functioning at a better level in his spinal cord. And the hope is that with more physical therapy, more treatments, things can get better. I know Cameron for a long time, and I can see that he sees better now. He's lost that nystagmus, that shaking eyeball business you have when you can't see. He fixates in certain quadrants. His functioning is better. He has more than just optic nerve hypoplasia. He has Demorsay syndrome, which is more of a global defect in the midline of the brain. It affected the pituitary gland, the hypothalamus, the structure of the brain itself. And we are proof positive, X-ray-wise and functioning-wise, that he's doing better. Is he perfectly normal for a child his age? No. But he's presented, the family's presented with no other option by his other doctors, and they said there's nothing else that can be done.
After my treatment, I was so inspired. It was such a life-changing experience. I formed a nonprofit corporation, Stem Cells for Hope, and we are educating the public in the stem cells that are available, the therapies that are available now to treat neurological diseases and disorders. After I came back, I felt so good. I felt like I had not felt in 25 years. Everyone could see the difference in me, and so I started talking to groups. I went to the MS Society in Baton Rouge and talked. After I talked to everyone and they saw me and my before and afters, and as you can see, we did lots of interviews, videos, and things like that, except I don't look like the same person because I have blonde hair. And no, the stem cells did not cause that. Only my hairdresser knows for sure. But 6 people from Baton Rouge, where I live, have gone to China. They have MS also. And every single one of them has had improvements. And to me, just 6 people out of the small city that I live in is phenomenal. We have to get the word out to let people know. And I do have to say, when I was in Shenzhen, I was the only person who had multiple sclerosis. There were spinal cord injuries, there were, we even had someone who had a gunshot wound, a little boy from Egypt. But it's a global community, and to a person, every single patient that was there, they were all questioners like I was. Their doctors had told them, no, don't go to China. It doesn't work. You're wasting your money. Don't go. And every single one of us was there. And I can tell you, one person who had ataxia, he was our champion, JC. When he came in, he had severe double blindness. He could not see without holding a hand over one eye. He had a cane. He could hardly walk. When we left, he was jogging on the treadmill. And we were all in there laughing and crying and taking pictures and cheering, and it was the most phenomenal thing I have ever experienced. And he has since gone back again, and it's amazing. It's been 1.5 years since I was in Shenzhen, and JC was there at that time. He has had to go back, so different diseases react differently to the stem cells. But the minute he goes back and starts getting the stem cells again, he starts getting improvements again. And it is not a cure, but it is a quality of life issue. It gives you a jump start so you can start doing other things. That's what I love about the Chinese. They treat your whole body. You're not just going there for stem cells. You're going there for rehab. You're going there to acupuncture. You do everything. They're very strong taskmasters.